Yeah.
Where do you think that?
Right?
Remind them they have to put, they didn't put a lot in here. Them.
Oh, Henry.
Mm-hmm.
So this is our live
Right,
on Facebook and YouTube,
right.
right? This is their live. He's seeing you,
Mm-hmm.
so he's gonna put you on the thing. But our message will tell you.
Tell them here the numbers that I had given them. They had to make sure and put that. No, that's good. No, that's nothing. Yeah.
Hmm. Hmm.
We step it up. Mhm. Welcome, welcome. Thank you very much, rather, Mr. Boris, and of course the persons of Synergy TV. Always a pleasure to be here discussing health from a natural and integrated perspective. Interestingly, on this program so far, we have touched on a number of serious health topics. We have touched on diabetes, we have touched on hypertension, we have also highlighted to individuals, what we do at Batson and Associates from an integrated perspective with that integrative diabetic clinic. So, those of you who are diabetic and have issues, especially as it relates to eyesight, when you are a diabetic, the likelihood of having problems with your eyes is significantly high because of that poor peripheral circulation. In addition to that as well, it's very easy to lose toes, lose limbs, again, because of the poor circulation in the body. At Batson and Associates, that is something that we often highlight. And one of the products that we actually use is a product known as Circulation Regeneration Tea. Now, why I wanted to speak about that product this afternoon, apart from the health discussion that we're having, is because it's very easy. It is a tea, wild crafted tea, so you normally use like 1 teaspoon or half teaspoon in about a 16-ounce cup. I always tell persons when you're drinking tea, the rule is no milk, no sugar. Try and have it as natural as possible, of course, to derive the maximum benefit. Now, when we're talking about poor circulation, the thing is, diabetics always come to mind, excuse me, because you often find that diabetic individuals usually suffer from poor circulation. However, you can have poor circulation and not be a diabetic. And this is something that I've explained to persons on numerous occasions. The last time there was a question that was asked where someone was saying that their cholesterol level is good. They were saying that their blood pressure is normal. However, their feet usually swells. They always experience swelling in the ankles, swelling by the instep there. And they came to us, and when we did the various examinations with that magnetic resonance analysis scan, we were actually able to realize that they had compromised the circulation in the extremity, especially in the veins in the legs. There was some problems with circulation there. We further sent them to have a Doppler done. A Doppler is actually an ultrasound of the legs. And when the ultrasound was done, it did again show areas where circulation was compromised. Of course, we made various recommendations. The circulation regeneration tea was one of the products that we actually used with them, together with the Alkagen water, that premium alkaline water that actually helped that situation. So, those of you who actually listen to the program, those of you who may know about Batson and Associates or may not be aware of Batson and Associates, but you're looking to really deal with that situation with diabetes, that pins and needles, that cramping in your calves. You may have an indication or an issue where you are a type 1 diabetic, so you may be using insulin. So you may normally take your insulin maybe in the morning and in the evening. Usually it's recommended twice. And of course, you need to be testing your blood sugar on a daily basis so that you know how to maybe in some instances actually adjust the insulin, because that's very, very important. So at Batson and Associates, we'll give you further guidelines where that is concerned. But of course, the objective is to improve that circulation, improve the blood sugar levels readings, as well as to improve even the situation with the eyes. Because as I said before, with diabetes, you often find that they have serious poor pulmonary circulation, which is circulation above the heart. And as a result of that, you find that circulation in the brain could also be compromised, where you are actually showing early signs of things like stroke. There's a condition known as a TIA, which stands for transient ischemic attack. Now, if you have been diagnosed as having a TIA, they would have to do an ultrasound, an MRI, of the brain, or CT of the brain, to really determine if you in fact had a TIA. Now, at Batson and Associates, with that magnetic resonance analysis scan, that actually gives us a reading in terms of the limit or the functionality as regards to how much blood is going to the brain. You find a number of persons maybe having problems with blurred vision. You're having problems with, as I said, pins and needles, cramping in your calves, problems with dizziness. A lot of persons experiencing lightheadedness now. Everyone who has a problem with lightheadedness actually has an issue with poor circulation in the cerebral hemisphere. So apart from dealing with circulation in other parts of the body, you're actually looking at circulation in the brain. So of course, those telephone numbers are there. You can give us a call, give us a visit. Keep in mind, we are also live on our social media platforms, so you can follow us there. We are Batson and Associates Limited on Facebook. And of course, on YouTube, we are Batson and Associates Trinidad. So, feel free to give us a call or visit. So apart from diabetes and poor circulation, one of the other topics that I wanted to touch on is the topic of thyroid problems. Now, your thyroid plays a significant role in your endocrine system. So the thyroid is responsible for the production of a number of things. It is responsible for your T3, your T4, and your TSH, which is known as your thyroid stimulating hormone. Now, you would realize now that we have a lot of individuals, especially women, and usually we have a program that we air on a Monday night. That's on our live. That's Batson and Associates Limited on Facebook. On YouTube, we are Batson and Associates Trinidad, where we actually deal with hormonal disruption. And I'll just touch on that quickly because we have a lot of women now who are experiencing serious hormonal imbalance challenges. Now, ladies, one of the things you need to pay attention to is that hormonal imbalance can affect you during any stage of your life as a female, including post-menopause. I'll say that again. Hormonal disruption, or what is known as hormonal imbalance, can actually affect women at any age or any stage of your life. Women are of the opinion, and in some cases, even some gynecologists, obstetricians would tell you that when a female goes through menopause, which is where she ceases having a menstrual cycle, usually a woman would cease seeing her menstrual cycle for about 2 years, which is 24 months. And once you experience that, it is understood that you would have gone through menopause. Now, what we need to keep in mind as well is that you have a lot of women who may not have gone through menopause, but actually suffer from hormonal imbalance or hormonal disruption. And as a result of that, they may not have gone through menopause, but they may just have had or have an irregular menstrual cycle. So how do you know you might need help? There are a lot of symptomologies to look at. Polycystic ovaries is a sign of hormonal disruption. Fibroids, hormonal disruption. Insomnia, in the case of postmenopausal women. So if you're having problems with insomnia, you're having problems falling asleep, remaining asleep, you may have problems with a very painful menstrual cycle. That is also an indication of hormonal disruption. Women, you may be experiencing at a later age, you might be experiencing a lot of hair loss. You might be diagnosed with alopecia, which is an immune or autoimmune condition of the scalp where you're actually losing your hair. You're actually seeing bald spots and that type of thing. All of those are key indicators of hormonal disruption, or what is known as PMS, post-menopausal syndrome. Now, I don't want you to get confused or mixed up because a lot of women do not understand that you can go through menopause, let's say at the age of 45. And you can end up with symptomology rather, with hormonal disruption at the age of 60, which is going to be 15 years after you went through menopause. So ladies, you can go through menopause and still have PMS issues that affect you. Look at the signs, look at the symptoms. Look at, for example, your blood pressure. Blood pressure or hypertension is a key indicator of hormonal disruption in older women. Insomnia is also something to look at. Vaginal dryness is also something to look at. Ladies, depression, panic attacks, weakness, extreme weakness in your legs, anxiety problems. Those are all indications of hormonal disruption. So, of course, those telephone numbers are listed there. 222-8261. That's 222-8261. And, of course, you can WhatsApp us on 314-9975. You can get some information as regards to that live nutritional blood cell analysis. I remember the first time I came on this program and I was having the discussion with Mr. Boris. One of the things that we highlighted was, dirty blood. And that is something that we continue to try to help our clients to understand, excuse me, especially from that perspective where there's life and death in the blood. So, of course, you can take advantage of the opportunity. You could check out some of the products and services of Batson and Associates. Nerve Restore is also one of my favorite products because I don't know if you are aware, this month they're actually recognizing minority mental health awareness. A lot of persons do not pay attention. Minority, yes, minority mental health awareness. That is actually, yeah, well, the thing is, when we're talking about in minority, we're looking at primarily in the cases of men, there's a minority there as regards to mental health. And I'll tell you something, we have a lot of men in our society who are not aware that based on the choices that they make as regards to what they eat, what they drink on a daily basis, could actually now affect their health from a mental perspective. So that is aspect looking at different minorities. We also have young women who have problems with polycystic ovarian syndrome. And polycystic ovarian syndrome. So we're speaking about school age girls here. We're talking about women who would have begun seeing their menstrual cycle as early as 10, 11, 12 years, 13, 14 years, and they already have polycystic ovaries. So they are a minority, and because of the hormonal disruption of polycystic ovaries, fibroids, ovarian cysts, that hormonal disruption can actually affect their mental health as well. So parents, this is where you need to pay very close attention to your young ladies. If you have young ladies who are at the age of seeing their menstrual cycle, mothers especially, have a conversation with them, because you have a lot of school age girls who actually miss a lot of classes and school because of having very painful menstrual cycles. And as I said before, that painful menstrual cycle is an indication of serious hormonal disruption. But of course, you want to deal with it in its infancy or as early as possible so that these women do not have serious problems going later on in their lives. And that is something that we address at Batson and Associates. So again, feel free to give us a call or visit. Keep in mind, you can like us, you can follow us, you can share us on our social media. We are Batson and Associates Limited on Facebook. And of course, our YouTube is Batson and Associates Trinidad. Keep in mind, the discussion is a question and answer. It is an open forum, so I don't know if you may have a question or anything regarding that as regards to what we're discussing. That's it. Right. Right. Bone cancer. Oh, okay. Right. Very situation. Okay. Mhm. Right. Of course. Yeah, 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 definitely. I mean, people who know me know I go in the realm, not necessarily of controversy, but of debate and discussions. And I mean, cancer has long been a debated disease. I mean, when you really understand what cancer is simply an imbalance in the body that creates an environment that is now conducive for cancer to really flourish. As regards to, and that depends on regardless of the type of cancer. So when you're dealing with cancer, you're really dealing with an immune system imbalance. And oncologists all over the world will tell you when you look at cancer, patients, they all have serious gastrointestinal imbalance. So, from the aspect of herbal medicine, which is not the only form of medicine that I practice, but I am trained in clinical and medical nutrition, which is very broad in its scope. And I am trained to design specific nutritional programs and dietary programs for persons who have cancer. Because if you are, in fact, a cancer patient and you're doing whatever you're doing, your chemotherapy, your radiation, whatever treatment protocols you are doing, you cannot, yes, yeah, you cannot leave out a nutritional protocol to now help the body apart from the chemotherapy and radiation that that patient may have agreed to do. You must look at the nutritional aspect of the body, because remember, even with doing chemotherapy and radiation, which is designed to kill fast growing cells, you also need to pay attention to the immunity of the body and keep the body in a position where it is now able to get an even better fighting chance. So, in other words, what I am saying, any cancer patient out there has to have some sort of proper nutritional protocol that is needed. I will give you an example. In the world of cancer and cancer research and nutrition, you will hear about something known as glutathione. Now, glutathione is the master antioxidant in the body. It is actually produced by the liver. But what research has shown is that glutathione supplementation and the implementation of glutathione, it has to be done particularly as regards to cancer patients. Yes, no problem. Okay, okay, good. Yes, I did. I did. The thing is, definitely, I believe it would. What I'm always mindful of persons, and this is something we have to remember, there are a lot of things that you can use at home that could help with a number of things. And we know that garlic, for example, is very good in the realm of circulation. We know turmeric is also very good as well. And you have so many other things. The thing is, there's a way I use it personally, where I actually take the garlic and I would sort of, as we say, pong, but it is in the skin. And what I actually do with that, and I advise people, is that you take it and you throw that garlic. So you do a few and you put it in some olive oil and you leave it and cover it in the olive oil for like about a week. And then what you could do with that garlic is that every morning you take one of the garlic out of the olive oil and you consume it. What that is going to do is going to start to help with digestive problems. Is also going to give you some help with circulation as well. What I wanted to say to the caller as regards to what he's talking about, mango leaf and cayenne pepper and that kind of thing. What you have to do, you have to be very careful with these things as relates to measurements, right? So measurement is very, very important. There are a lot of home remedies that you can use, but measurement is important, very, very important. Okay, yeah. She left. She left already. Okay. Well, the thing is, if you're talking about a pulling in your feet, I mean, going based on what you're explaining, the possibility exists that you could be having what is known as what they call pins and needles, junjuni. So like pins and needles, cramping in your calf. You're feeling like your feet is not yours. That is normally indications of poor circulation. If you are in fact a diabetic or someone who's hypertensive, well, then even more reason to really look at it from the perspective of poor circulation. Now, and that is where various testing is done. You could actually have a Doppler done, which is the ultrasound of the legs, or we do a magnetic resonance analysis scan on you. So with things like that, it's always good to get more information, and then from that perspective, we are actually able to help you further as regards to that. So it's always Yes, sir. Yes, sir. How you mean? Well, Mr. Boris, Mr. Boris, I have a very you don't worry, I have you and the director sorted out. You don't worry yourself. You'll be collecting your stuff shortly. I will make sure I will take very good care of you guys, man. You need good help. I like that. I like that. Yes, sir. Yes. Lymphoma. Yes. Yes, yes, I definitely saw what it is. Definitely an aggressive form of cancer. But again, I mean, I tell persons for the 15 years of experience that I have as a integrative practitioner, specialist, clinical nutrition, medical nutrition, I am consistently amazed at what nutrition can do for the body, regardless of the type of disease that you're dealing with. I mean, remember, your body changes your red blood cells every 4 months, right? Every 120 days, you get new red blood cells, you know. Every 2 years, you get new bones. The cells in the lining of your heart changes ever so often. So the body consistently renews itself. The question is, what raw material you're putting inside of there to give the body what the body needs? And that applies to anything, whether it's diabetes, hypertension, cancer. So definitely, from our perspective, I will try and reach out to the individual and give some advice where advice can be given, because definitely that is what people like myself definitely here for. And of course, we're gonna work assiduously where that is concerned. Those of you who listen to the program, yes, way over time. Yes. Definitely. Well, as we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. Your health is your wealth. Take care of yourself and allow Batson and Associates to give you that integrative experience so that you can now improve and experience better health, you and your family. As usual, it's always a pleasure. Till next program.